Welcome, everyone. Thank you for joining our second Parent Like a Pro Summit webinar. We're so excited to have you here tonight. So we have two amazing panelists. We have Lexi Birdman and Anushai Hossain. And I'm Maristela Lucchini. I'm part of Nanit Lab, the research branch of Nanit. I'm a sleep researcher. I'm a mom of three. You might hear them in the background at some point of this Zoom, hopefully not too often. I've been at Nanit for 2 years, and I'm really excited again to be here with you tonight. So I will let our panelists introduce themselves. Lexi, do you wanna start?
Hi, my name is Lexi. I'm a pelvic floor physical therapist. I treat patients out of New York City and Westchester. I am a mom of two, a 3-year-old and a 6-month-old. So I am still very much in the recent pregnancy and postpartum stage. So pelvic floor PT focuses on like rehabbing the pelvic floor, bladder health, bowel health, sexual dysfunction. So a large population that I treat is pregnancy and postpartum. And I love to share my knowledge in that area, specifically also because I just went through it. So I can't wait to.
Awesome. Thank you so much, Lexi. And Anusha, do you wanna take it away?
Yes, my name is Anusha Hussain. I'm the author of The Pain Gap: How Sexism and Racism in Healthcare Kill Women. It's an Audible bestseller, and it is also the name of my brand new podcast, The Pain Gap, which season 2 just launched this week. And
Much to celebrate.
yes. And my entire life, after a birth trauma experience, almost 12 years ago, is now just about believing and centering women in the healthcare system of the world's richest democracy. And I have two kids. I have a 12-year-old and a 7-year-old. Oh, my 12-year-old is going to be 13 in a week, but I am in denial.
Let's not acknowledge that for tonight. Fantastic. So as you can see, we are very well equipped with these two panelists to talk about the pregnancy and postpartum period, both from like a physical perspective to more like, like systemic approach of how we can support new mom and their families. So I think what we're going to talk tonight a little bit is going to be, we're going to start with the pregnancy period, then go into postpartum, and then in general sort of talk about some general comments of how we can really support and families to make sure that this period is what it should be, like really a celebration of a child entering in this world. Let's start with Lexi and thinking about the last part of the pregnancy. We're really getting ready for this child to come. We think you know what's gonna happen, but our body's changing so quickly. There's all these emotions, and it can get very overwhelming. And I think that it would be really helpful to hear from you a little bit. What do you think are some of the best ways, and like also practical ways, because we know parents are super busy with everything they have to do. So some tips, some practical tips where they can prepare their pelvic floor and bodies for delivery.
Yes, very important, and definitely a lot of like questions and anxiety around this period. So throughout pregnancy, I really believe you need to, if you are able to, stay strong and mobile and, work out when you can. But as you start to get towards the end of pregnancy, like 35, 36, 37 weeks, you really want to focus on relaxation. So the baby is going to come out. Your pelvic floor muscles need to learn to relax and get out of the way for a vaginal birth. So it's sometimes mixed, but I think it's important we practice like deep breathing, calming our body. And that goes for vaginal births and C-sections, because either way, you want to be able to control your body with your breath. So, the last few weeks of pregnancy, I'll have people do hip mobility exercises, deep breathing, really feeling like in tune with your body. And then still staying mobile in those last few weeks, practicing getting in different positions, being on all fours at that like 37, 38 weeks, making sure you can still get into that, because even for a vaginal delivery, but even for a C-section, post-op, You want to make sure you are familiar with still moving your body after it's gone through a ton of changes in the last 9 months, and then either a vaginal or C-section delivery. So deep breathing and mobility are my biggest tips for the last like 3 to 4 weeks of pregnancy.
Okay, got it. And some people already know that they might need to be facing C-section for, whatever reason, medical reason. Is there something in particular that you would recommend in those cases?
I would really practice again that belly breathing. So big inhale and big exhale, because when you are having that C-section, during, you want to make sure you can keep your body relaxed, and then after, you might be in a lot of pain, and it's still important that you can breathe and move in the bed. So definitely diaphragmatic deep belly breathing is my tip for if you're preparing for a C-section.
That's so interesting because I was thinking, I wanted to touch upon some practical tips for sleeping better at the end of pregnancy. And one of the things that we really recommend is also sort of these breathing techniques, these calming techniques, because very often one of the things that is interfering with sleep is not just, of course, like, the physical aspects, like you can't move, you can get in your comfortable position. Maybe you're used to sleep on your belly. Now, clearly you cannot do that anymore. Um, but it's also like all this stress and all this tension. And very often people complain of tensions around the hips. So
Mhm.
I kind of never, yeah, I mean, like I sort of thought about it, but I was thinking, right, there's a lot of connection that goes with sleep and muscle tensions and all these deep breathing techniques that can really help you sort of calm your mind and your body and get into a space where you can really rest and relax, which is super important for so many reasons, but a lot of people don't know that actually there have been some studies linking the quality of your sleep in your last trimester with the length of your delivery and like the risk of C-section, which I just think again it's such an interesting thing. I see there's like a lot of comments coming in and saying I did pelvic floor physical therapy during pregnancy, and I swear it helped me. It helped so much. I recommend it to all the friends. So you have already a fan here that. Um, but I use the Sculpt Society pregnancy postpartum program. So I see people are sort of like on your team. And I love how you sort of start the conversation saying it's healthy and good to keep, doing exercise throughout pregnancy because often that like there's a lot of stigma and worry that, that might not be good. But it's really good to keep the muscle sort of strong, right? And sort of leading the way.
Yes, you're growing a baby, your pelvis is changing, your whole body is changing. So depending on obviously what you're cleared for and what your doctor allows, but it is important to stay mobile and active. But then I do honestly usually tell people to kind of drop the activity in the last few weeks, because you shouldn't really be, tensing and working everything in those last few weeks. Again, you want to relax the muscles, not tighten them more. So that's like really important.
Right. So I see someone that says, "Oh, I wish I did it. Is it too late now that I have a year-old?" It's not. But we're gonna get to that in the second half of our conversation. So stay tuned. Don't leave us. We're gonna get to that. And going back with some of the tips for sleeping. Um, so as I was talking about, like there's some physical sort of concerns. Like so, position is very helpful. I don't know, like in situations where people have some, tensions in their hips, there are some position that you would recommend that might help sort of ease the tension and relax the muscles
Mhm.
at night.
Yeah, so usually, if you're able to still sleep on your side, you always want a pillow between your knees. You want to think your hips and your pelvis has widened, especially in the last few weeks, which is a good thing. But you want your knees like in line with your hips. So if they're touching and you're getting this like deeper angle, you're going to have a lot of pulling at your low back and your hips. So a pillow between your knees is really important. And then also, if you're on your side, a pillow at your back, so that you have that extra support and you're not just feeling like you're like falling forward. So yeah, usually, you know, in the third trimester, you should be sleeping with like 3 or 4 pillows. I tell people like create your little like pillow,
You're
you know,
sharing a bed with your
thing.
partner. I'm sorry for them. Kick them out. Take your
Yeah,
space.
get it there. They gotta go. And I do usually like a bunch of pillows, not you. I mean, everyone's a little different, but I find like 3 or 4 pillows rather than just that big pregnancy pillow works a little better. But again, it's a comfort thing. But yeah, you're gonna take up more than half the bed in those last few weeks.
Like to plug the full body pregnancy pillow, which is what I had. So you can in the back, in between your legs, turn around. And yeah, sure enough, the last couple of weeks, my husband was like, what about me? I was like, I'm creating eyeballs and a brain. I need my sleep.
And now you can throw in, I need to sleep now. Yeah.
Yeah, and yeah, that's usually the position we also recommend for so many reasons. Like, of course, you're not gonna be able to be in your belly anymore, but even being on your back, it can have some sort of complications. Not only like there's the weight of your belly that could sort of compress some of the veins and in the back, but also it could increase your risk of snoring, and we know that we want to avoid that in pregnancy. There's I mean, it's normal to occasionally snore here and there, like for many reasons for the belly, but also there's some changes in the breathing airways. So it's normal occasionally. There's nothing like to be extremely concerned about, but we don't want that sort of to become every second of your night you're constantly snoring and potentially developing apneas, which is something that also the side position helps to keep those airways open and breathe at best. And so when part of the work that I was doing, and so this is leading a little bit into a question for you, Nushay, I did a lot of work on disparities in sleep during pregnancy. And so one of the things that I worked a lot on were disparities in sleep disorder breathing, which is sort of like a big umbrella term of like goes from snoring to apnea during pregnancy, and seeing like how some groups, especially women of color, were more likely to have sleep apnea during pregnancy, but very often they were not receiving the proper care. Like they were raising some concerns, but they were like, yeah, the providers were like, yeah, it's normal. You don't sleep well during pregnancy. It's fine. Don't have to worry about it. Whereas in the meantime, their health was really sort of deteriorating. They were not getting the sleep that they needed, and now we know that snoring and apnea during pregnancy is linked with so many complications for the cardiovascular system. So just sort of using that as a link, I wanted to hear a little bit about your experience of how really women can advocate, how they can have these conversations with the healthcare providers whenever they have some concerns. There's so many things that we get concerned when we're pregnant, and we want to make sure that we are able to voice them and we're able to get the proper attention and the proper care. So I wanted to hear from you a little bit about that.
That is a great question, and it's something that I think about every day. And it's sad because the onus really should not be on women. How do I get somebody to believe me? It's the same way of being like, how do I not get robbed? But in the meantime, while we fix so many things in our culture, in our healthcare, unfortunately, women have to be very, very active in their healthcare and have to advocate for themselves because you will slip through the cracks. America doesn't have one of the world's highest maternal mortality rates because we don't have resources and we don't have the funds or the research. And we have it because not everyone can access. Not everyone can access these resources. And we know, of course, that maternal mortality tells us, not only the number of women dying in childbirth, but how well a country's healthcare system is functioning, what the overall position of women is in the society. Because really in 2024, nobody should be dying giving birth. I think what women can do to advocate for themselves is, first of all, a lot of people I really hate recommending this, but it's true. Bring somebody with you. If you can have somebody with you. I can't tell you how many women I have spoken with and interviewed, women of all, from doctors to surgeons to receptionists. If you can bring a friend or a male colleague or partner with you, it usually helps you getting believed. If you can't find a man, that's fine. But having just somebody there who can back you. But also, I think the most important thing for women to know is that you have choices. Even though I was lobbying on Capitol Hill and working on global health legislation, I had no idea when I went to give birth in one of the best hospitals in Washington, D.C., that anybody died in America giving birth. I actually didn't think it was possible. And there's so many things that you have to inform yourself about, but I feel like people make you think about the wrong things, like your baby clothes washed and organized, and is the room done? And it's like, gosh, I wish I had somebody who told me, take all the underwear from the hospital, the disposable underwear, take it. Oh my God, casseroles, food. Like there's somebody in the early days to let you go and take a shower. I think that what is uniquely complicated about America and American culture is that in most other places in the world, it takes a village and the village will be there. But in America, the village is not there. You live far away from the village and you will have to create your own village while you're probably breastfeeding and doing a conference. It's all going to happen at the same time. So I would tell women to remember you have choices. I wish people told me that. You don't have to have an hospital birth. You can give birth with a midwife or have a doula if you don't have any complications. This is not medical advice, but I didn't know. I thought everybody had to go to the hospital to give birth. No, you don't. That's usually where things go really, really wrong. Make sure you trust your provider. I was so close with my doctor, and guess what? She wasn't the one who was delivering me.
Yeah.
I
I
had,
was shocked about that. Like
I was shocked.
in,
I was shocked.
yes. Uh,
Terrible.
yeah, we have someone asking about like what do you think about doula? And I think like going back to what you were saying, like it could work for some people, it could work for not work for others, but the point is like if that helps you create sort of this village around you of
Yeah,
support, if that's what makes you feel, accompanied and supported, then if you can do it, it could
do
be a
it.
great investment, right?
Also, it's so important. So, not to scare women, but really, as soon as you start going into labor, the attention is already going away from you. No one is focusing on the mother, postpartum bleeding, postpartum depression. I mean, it really is. In my maternal health advocacy work, there's a really famous metaphor that the baby is the candy and the woman is the wrapper. You just throw the wrapper away. And it really is like that. No one is. I wish, I mean, I don't know. I'm going to stop talking about my traumatic birth and just having someone there who can voice your concerns, who can tell them if you're in pain, who can tell them that, anything that is happening, because so
Yeah.
many things can go wrong. You can get a postpartum hemorrhage. So it's really important. And I wish I had a doula. And I always tell people now that if you have the option, get it.
And I think like, when I had my first kid, I was 25. I had just moved to the US 3 months before. So I didn't know anything about this country. Luckily, I could speak the language, but I feel like it was very hard for me to feel like I was taken seriously because I was so young. And going like thinking about it now, 10 years after, I'm like, I wish I could sort of trust that what I was feeling was valid, no matter if who was in front of me was not sure about it. And then it proved to be actually true. Like I was having some issues. But I mean, like, of course, now it's easier with the benefit of insight. But at the same time, like there's no wrong question. There's no wrong concerns. Like whatever you are going through, it's great to get it out and make sure that you don't leave that room until you have understood the answer. Like I think that's also something that like this conversation doesn't have to be just for the extreme cases. Like it doesn't have to be for that moment where you're about to have an hemorrhage or something, like, but even for the little things, like you have to do this exam. What is it for? Why? Or like what could be the consequences? How might I feel after, like, all the questions. And if you're not sure about the answer, ask it again. And I feel like here sometimes there's just short time during this visit. You feel like you have to rush through those things, and then you leave the room and like, oh, I don't think I understood anything about it. And then the next appointment is in a month, and you don't know what to do in the meantime.
I also have seen in my work and my research that women really try to be the perfect patient. We try to be the perfect because we're told we have to be. We see it on Instagram and Pinterest and whatnot. But women really try to be the perfect patient, just like we try to be the perfect wife, the perfect dog. And we're really trying to do this right. So you don't want to ask dumb questions, but hey, body, you're giving birth to a baby. Just like Marcella said, no wrong questions, no dumb questions. And it's your body. I really felt like when I went to the hospital, I had no agency, that all my agency was given away. And that's not true. You can speak up
Yes.
Yeah,
for
no, and
whatever you need.
I
Sorry.
feel like the education component is huge. That is sometimes missing, right? Like we should know going into birth what could happen, right? Like what the options are. What is a vacuum? What are forceps? What's the, time that I might be in labor before we're talking about a C-section. Like all that stuff is very important. What pushing positions are. And I am constantly finding myself, with my pregnant patients explaining that stuff. And that's just a small population of pregnant people that do come to pelvic PT. So we're missing like a huge group that either don't have access to pelvic PT or didn't even know to come. And, I'm explaining other concepts about what the labor and delivery room might even look like. And it's just like a very, important thing that's missing in birthing here.
I think
One
like,
last thing
oh, sorry.
sorry.
No,
One
no, I
last
was
thing I'd like to say is that
go, go on.
this could be a
There's a little
seminar,
step back.
okay?
You
1
go,
hour.
go, you go.
One other thing I wanted to say was that if you want a natural birth and really, really don't want C-section, be ready to either fight or talk to your doctor because that really, C-sections in America have increased 500% in the last generation. The way we do C-sections in America is, I don't want to say it's not normal, but it's the most common surgery that we perform, and it's a major, major surgery. So and some people like, I really wanted to have a vaginal birth that was completely taken away from me. So know that if you want, fight for what you want. And you don't have to be rude and be like angry about it, but be very, very clear and stern about what you want. And when you're going into labor, make sure either your partner or your doula can advocate on your behalf.
Yeah. No, I think that that's so important to be clear and like sort of assertive about what are your expectations. And of course, things could change. Things might have to adapt. The not all our plans sort of go and happen as we envision them. But at the same time, like I had my first emergency section, but then I really wanted to have other two vaginal births and I asked for it. We went through all the plans. They told me what I had to do and I was able to do it. And it felt so rewarding to be able to to get that experience after such a first traumatic birth. And I can't thank enough my provider. Like, and one thing that I was thinking is that I've had three births and I've had three different doctors. And that's because after my first doctor, I was like, I'm not gonna go back to this guy. This was the worst thing of my life. And I think I had given for granted that I didn't do a lot of research. Like one person I delivered with this guy was like, sure, I mean, that's good enough. He just need to get the baby out. Won't be that complicated. And then, the second time around, the third time around, I was like, well, maybe no, maybe this other person, like I did a lot of more research. And I know, as you were saying, like it shouldn't be on us. And I don't like, in a time when you already have so many things you have to worry about. Like, I don't want to make this feel heavy, but at the same time, like, as when you're choosing a house, you want to make sure that it's going to be the right fit for your family and for you. And again, like, you are choosing the person that will be there in such an important moment of your life. Um, it's good to hear opinions, ask, read the room when you go in the waiting room, see who the people are, and get that feeling. So that was one thing that for me was so important. And then, as Anusha was talking about the the delivery mode and like what are sort of our birth plans, and I was just thinking, could we maybe discuss and give some tips around creating a birth plan and managing expectations while staying flexible? I think, as Anusha was saying, it's important to sort of communicate with our intentions, but at the same time be ready. Oh, we lost her. Hopefully she will rejoin soon. But we can start, and then I'm sure she will jump in. How we can have, a plan and be prepared for the plan also to change. What
Yes.
are your thoughts?
And I think this goes back to, having to do research, asking questions, like knowing about the birthing process. So, like, okay, if you really want a vaginal birth, what are my options during this time? Epidural or no epidural? Vacuum, forceps, like how do I want it and where could things go wrong? And then what would be my choice in that, decision that I'm faced with? And really important, you're communicating that with your partner or your doula or who else is going to be in the room, because the birthing person is going to be under a lot of stress and maybe not thinking clearly. And if you just kind of think about it beforehand and talk through it with someone, you might be able to say, like, listen, if I push for X amount of time, I'm done. I'll take the C-section, or like I will push forever and I will take the vacuum. And I think that's important to communicate. You can even tell your provider that before, and again, looking into like, okay, if you're not delivering me, like what other doctor might be there, and just
That
like,
exact, and I think that's where the partner is so important, because you might have talked to your healthcare provider, but then that night someone else is there and
mhm.
I don't know you, and so that's when like your support person, whoever's gonna be there with you, or have it written down. If
Yes,
you're
yes.
at
Oh,
home,
totally. I've seen
have it
like flow
written
charts,
down.
like this, if not this, this, and that's fine. Do that. It's a big event. It's a huge event. And
Do
sometimes, yeah,
that
I think
for our wedding when we plan everything. Like
yes,
we do that for our
we talk more about the like, oh, the crib and the stroller and all this, but not necessarily like the day of. And I think that's important. Definitely going in flexible is also important, because there could be things that arise that are like, no, we're sorry, this is what is going on. But again, if you kind of have an understanding of the things that could go wrong, then you'll understand if that is, high priority of, okay, this is what we have to do now. So I think that's equally important. And then, oh, good.
Glad to have
I'm
you
back.
back.
Sorry. I
Yeah.
don't have no idea. I'm so sorry. Totally lost
You were
my
so
internet
fast
connection.
getting back on track. Thank you so much.
Sorry.
Good.
We were just talking about, creating a birth plan, making sure that people around you know what you want, but also managing your expectations and knowing that it might be important to stay flexible and be prepared for things to shift and change,
Yes.
during the delivery. And I don't know, Lexi, from your sort of perspective of as a, pelvic therapist, are there some things that also partners could help during the delivery, like I remember, for me, I remember I just wanted to be left alone and focus on my pain. But I know that like that was me, and I knew that that's how I react to the situation. I wanted him there, but I also wanted him to be quiet. Uh,
Yeah.
and get me a burger when my baby had come
Yes,
out.
yes.
But some other people might benefit from like some physical touch, some massage. Are there some things that you would recommend?
Yeah, so I think it's important too, and I do this with my patients, practice pushing and practice the breath that you're using while you're pushing, while you're not under this like high stress situation of being in a labor room and maybe with an epidural. And so you want to practice all that stuff before. You also want to practice pushing in different positions. It is better to push with your sacrum, not your back, not like on the bed, which is not easy to do if you have an epidural. So you probably do need a partner that's going to help turn you, and even communicating to your partner, listen, I shouldn't really push on my back. Can we make sure that when I'm pushing, my sacrum, my lower back is off the bed? And that either you could even practice, and moving you, especially with the epidural, practice getting into different positions. They can help lift you over the bed. It's like kind of a misconception that once you have the epidural, you can't move. Like you can be twisted and stuff. You just need help with it. So that's also definitely, I always like to remind my patients, like you can still move and you really should. So get your doula or your partner involved in moving you, because you're probably not gonna be able to do it on your own.
That's so interesting. I didn't know that.
Mhm.
You always
I
think,
have a quick question. I don't know if I'm allowed to ask this, or if I'm allowed to ask a question, but oh my goodness, I totally lost it. Sorry. Okay.
you can type it in the chat later if you want
Okay, good.
to.
Go
Um,
on.
so I'm just cognizant of time. I would talk about this forever and ever, but I really want to jump on sort of like the second half of our conversation, which is more about what happens after you have the baby. And I think like going back to what one of the mom was saying, what are the changes that happen afterwards from a physical perspective? What are some of the things that mom should prepare themselves to face? And maybe they haven't done it before, pelvic for therapy. Maybe they're 1 year after. But what are some of the things that we should be prepared to face, and what are some of the things that we can do to be best prepared?
Mhm. Well, your whole body has changed, right? So for 9 months, your pelvis widened, you grew a baby, your hormones changed, even your workouts are probably different than what you were doing. So it's living in a different body for, right, 9 months. And then you give birth, which is a massive event, whether it's vaginal or C-section to your body. Both ways, it's a huge trauma. And then you took 6 weeks off probably of exercising, and then at 6 weeks you're told, okay, go exercise, you're fine. And you really need to take into account that you're in a totally different body, and you need to go slow, and your muscles are weaker, your abdominals aren't together, your pelvic floor is probably you know, acting in a different way, whether it's painful or there's urinary leakage. So that's the first thing I tell everyone. You have to give yourself like some grace. If you had knee surgery, you wouldn't just like go say, oh, I'm going to go exercise on this knee now. And you need to treat your body like that. But things the actual things you do want to look for is weakness in the core, right? So ab separation, which is going to happen during pregnancy no matter what, because we're growing a baby in there. So our abdominals need to move apart so that our belly can grow. But then are they going to come back together, and can we engage them properly? And so that comes from two things: using our core. People get a little concerned about like aesthetically what it looks like, but also our core supports our body, right? So we want to make sure we're not getting back pain or hip pain or, pelvic pain from that. And then another big one postpartum can be urinary leakage, because the pelvic floor muscles have gone through, again, they grew a baby, they pushed a baby out. Even if you had a C-section, they were, very, very stressed during pregnancy. So that's one thing I see. And something can be done about that. So that's certainly, whether they're too weak, whether they're tight, you kind of need to assess what exactly is going on with those and what is creating the urinary leakage. But it's certainly something that I see a lot and that can be treated. And so usually you if you are experiencing urinary leakage, it's really important you either bring it up to your provider or see a pelvic floor PT.
And to reach out to a floor PT, when is the best time? Like after delivery, is there like a timing? I mean, as we said, like it's never too late, but
Yes.
also is there a time where like we should be thinking about it more?
Yeah. So, usually 6 weeks is when I'll see someone. I sometimes see people before, but usually we're waiting to get the clearance from the OB, like, okay, you're good. Certainly I see people before that, and it just kind of tailors what we do. But once you're cleared for exercise, I think it's usually important to consult with a PT before you just go and either jump back into your old exercise or see how you're feeling. It's just good to get cleared that, okay, my pelvic floor muscles are working well, my abdominal muscles are working well. What hurts? Was there tearing during the vaginal birth? Is there pain at the C-section scar? All of that is like what we're here for, and to look more in depth into that. So I usually say 6 weeks, but again, never too late to see anyone. And then I do see people sometimes before that if they're just like feeling good and want to start doing some things.
That's so interesting. And I think like I was thinking about it, it's great also to have these conversations before and be prepared, because when you're in the middle of it, you're also going through such, an emotional roller coaster, and you're so busy and you're so sleep deprived. And so it can really get overwhelming. Like, oh my God, there's this thing too. Like I was not expecting it. How am I going to manage it? Whereas if I'm prepared before, I might, have, a pelvic floor therapist, like already have a number, I've already know where it is. And, just maybe I'm not going to need it, but if I do,
Mm-hmm.
I'm prepared. And so I think that's it's great to have this conversation before. And then, I remember with my first pregnancy, I was also a little bit on the other spectrum, when I was like, I'm gonna just power it through. And, it's normal to have pain. It's normal to be struggling, but I kind of have to, you know, just
Yeah. You
go
got
through.
to do it.
Gotta do it. And I remember
Yeah.
like I had my baby, I had to leave my baby at the NICU because they discharged me, but the baby was there for 2 weeks. I was going back and forth to my baby as much as possible. I had a C-section. And after 3 days, I was, taking the bus, going back and forth, and nobody would give me a seat because I was not pregnant
Yeah.
anymore. And and at some point, my husband was like, "Why are you not asking them to please give you?" And I'm like, "It's fine. I'm not pregnant." And he was like, "What are you talking about? You had a baby a week ago. Like, your baby's in the NICU. You're pumping me. You're
Yeah.
completely like." And I think like
Oh,
there's also this thing, and this goes back a lot to the work that you do, right? So, Anusha, like this pain gap that is
yeah.
we just assume it's just normal that we have to go through these things and accept it without questioning it.
Exactly. Well, there is a pain gap, but before I get to that, I wanted to also say that there's no such thing as bouncing back. Okay. You're gonna have this impression that something is wrong with you, or that you're broken because you couldn't bounce back. Trust me, I tried to bounce back, ended up landing on my head. So I think women need to really remember that it took 9 months to grow this baby, and your body has done so much. We put so much pressure on women that if they, don't have the post baby body back and all the wrong things, but your health is so important, and it's important to remember that it's not an inconvenience. You will feel like it's an inconvenience when you have a newborn baby that is reliant on you for everything, and a C-section is a major abdominal surgery. Guys, they go through like 7 layers of your stomach. People make it sound like, oh, the baby's just in and out. No, it isn't. And let me tell you, if men had C-sections, they would get 1 year paid off definitely to recover. Another thing I would say is make sure you get paid leave. What is your company or your organization's leave policy? Because as we know, paid leave is not mandated in the US. So every woman is really on her own, and her situation is different. The thing about the pain gap, which is really important, going back to your question, Marcella, is that there's not only a gap in how we view pain between men and women, it's also how seriously we take it, how we believe it, and how we diagnose and medicate it. Women and our bodies, it's a really fascinating, infuriating field, like Advocacy, as you know, because people expect us to have a really high threshold of pain. It's like biblical women's threshold for pain. But when we tell people that it's too much pain, they don't believe us, or something's wrong because this pain is so bad. And then the thing is that there's a knowledge gap, a pain gap, and a credibility gap. Women are not believed about our pain, but we're just not believed about our bodies. I've found in my work and my research, period. If we've been raped, if we're in pain, if we've been sexually harassed. So there's a much larger issue of women not being believed. But also, you will see a huge difference when you've been pregnant in America and when you haven't, right? No one's getting up offering a seat for you. No one's opening the door for you. It's incredible when you're pregnant, the chivalry and the kindness you'll see. And then you have a baby and a stroller and a carrier and the baby bag, and no
You're
one.
bothering them. That's how
Some
you
other
look at it.
mom.
Like, oh, you're taking so much space. I'm like,
Yes.
You feel you're like, my boobs are bleeding and I just had a major surgery. Can I have
I
a seat? I won't ask for a seat.
here in New York, when I had my first baby, to hop on a bus, you would have to close your stroller.
Mhm.
And I remember, and I was
Oh
like,
my God.
my baby just fell asleep. How am I going to take her out and close this stroller? I don't know. And I decided, like, sometimes I just decided to walk. I'm like, I'd rather
Yeah, I was just gonna say.
20 minutes than like wake up my baby or like
Mhm.
now you can
Yeah.
keep it open, but sometimes
You,
it's
you have to wear your 15-pound baby if you're going to take the bus because you know you can't. You walk around the city wearing it.
New York life.
Yeah, yeah, yeah.
Don't forget to wear your baby.
Well, the bus thing's so interesting because think about someone having knee surgery, whether it was a big surgery or not. People are getting up to sit, giving up their seat. They're taking their own, we just don't think of C-sections as like this massive surgery, even though it is
It's a massive
bigger than
surgery.
bigger than a knee surgery.
Actually, no one told me it was a major surgery until I had my second one. I'm like,
Oh yeah.
Yeah.
perhaps this was bigger than people made me think it was.
Mm.
But that's what I think we going back to that point, which is so important. Educate yourself and inform yourself, because you will have to advocate for yourself. And if you can't do it, make sure you have people in place, because things are not going to go according to plan. Welcome to parenthood. It's not going to go according to plan.
And I feel like,
Maybe.
yeah, and it's not like, sometimes these conversations can feel like, oh my God, like heavy. But I feel like, sometimes it's when you're not prepared if things get scary, right? If in
Yeah.
time, you get to ask some of these questions, you kind of do some research, it doesn't have to be overwhelming.
Yes.
You can sort of chew a little bit at a time, but
Yes.
don't do that, then that's when it becomes overwhelming because then you have a problem and you kind of have to find a solution. Like I remember when I got a bill like money that I had to pay the insurance when my baby was still in the NICU, and like again we had just moved 3 months before here in the US. We didn't know anything about the insurance system. I think for me that was actually one of the most scary and like strange things about delivering here in the US, that every time something was happening, I also had the thought about how much is this going to cost? Like, what are they going
Yes.
to charge me for this? And I thought that, and I felt so guilty as a mother that that was a thought that I had because I'm like, it doesn't matter. Like, my baby comes first, but also if they're going to charge me, $50,000,
$100,000.
I don't have them. So,
Yeah. Well,
it,
medical debt is real. Medical
yes.
debt in America is real. So yeah, that's a lot of stress. I don't think people outside of America understand the unique um, obstacles we come up against with our insurance system. It's really unique to America. And no
Mhm.
matter how much you pay, you won't be able to get what you
Pay
want.
more. Yes. I
So
want to pay
insurance is a
more.
huge stress. Yes.
Yeah. And I think this is important to sort of um it can feel a little isolating when you are, you th- you think you get pregnant and you're so excited and you're preparing yourself to meet your baby, and then but you also feel this stress or like this sense of like I'm doing something wrong, or am I the
Yes.
only one going through this? And
Mhm.
it can make you feel wrong. It can make you feel like you're doing something wrong, right? And so these conversations are not to scare, but so to make us feel like that to understand the context that we are parenting or birthing in, and
Mhm.
and I think like really thinking about this sort of systemic things, and there's been some changes. Like I think about when I had my first baby 10 years ago, my husband had 0 days of paternity leave, and now
Yeah.
with my third baby, 7 years after, he had 3 months more than me. I had 8 weeks. And so I'm like, yay, there are some things that are changing. There have been some
Yes, they
improvements,
are cheap.
some
Yes.
places more than others, some companies more than others, but really
Yes.
putting our experience in a bigger context to be able
Yes.
to, understand that we're not the only one. It's not us. We're not doing anything wrong, and to learn how to live in this system.
Yes, exactly. And also knowing that the issues are systemic. It's not your fault. I
Mm.
felt for so long that what happened to me happened because, maybe I should have done this, maybe I should have done that. So a lot of it is systemic as
Mhm.
well. It's not your fault.
And
Exactly.
opening the conversation, I think I love that you said this earlier about like thinking about more than just the baby and like, the baby clothes and stuff, that like the mother is also involved, the birthing person is like also part of the conversation
Remember the
the
mom?
whole time.
100%. And I think, I had these questions about, how um, can we've talked a lot about having a person, a partner, or, whoever we feel like it's the right person that we want with us during the delivery process. But I think like also thinking about that postpartum period, what is the
Yes.
best way that we can create this village initiative that you were talking about? Because there might be a lot of people that want to help. Not necessarily everybody
Yes.
will understand the best way to help. How can we sort of, and like everybody, meaning, coming from the best place possible, but, how can we maybe set us up for success, accepting
Yes.
this help, creating this village? What are some tips that you would give?
Oh,
Uh,
I wish somebody had, sorry, I wish somebody had asked me this. So I actually could have implemented what I wanted. My postpartum period was terrible. My in-laws were there. My mom came from Bangladesh. I had friends coming to see the baby that I was like, can nobody ever touch or breathe around my brand new baby? Oh my goodness. Please more than your baby shower or gender reveal, have a postpartum plan. Do you have childcare? Who can come and see, watch the baby, so you can get some stuff done, so you can go sleep, so you can go shower, so you can go to the bathroom. There's basically, when you have a little person that you have to take care of, you'll be shocked. You really don't even have time to go to the bathroom. So have a
Which is
structure for your
also not
postpartum.
super easy right after having a baby. Going back to very
Oh, by
practical
the way,
tips.
yeah, the
Just
first
saying.
poop, very important, and it's not easy.
Which we need to talk about before you give birth.
There you go.
What to do.
Exactly. You need to have a setup, because after you give birth, everything has changed. So, and make sure you have childcare, make sure you have food, make sure you have some frozen dishes that you can just microwave. No one's thinking about what the mom's gonna be eating, but when we're feeding our baby and the amount of calories that
So
we're burning,
hungry.
it's so important to
Yes.
be nourished. And in other cultures, I mean, I grew up in Bangladesh, and we have a lot of patriarchal issues, but we never isolate a pregnant woman or a new mother. You know, everyone surrounds her. You have paid leave. People are like bringing food. Like, everybody knows you have like 40 days of rest. It's like a big thing. But in America, you don't even have 40. You don't even have 40 minutes. You don't even have 40 seconds.
Yeah. They're
So
suggesting
you
like
really have
meal
to.
train where all your friends, bring food. And I
Yeah.
think, the food piece is so important, not just because you're very hungry. I remember eating like a whole dish of tiramisu the first night I came home. I was so hungry. I woke up in the middle of the night. That was the first thing I could find and just
Yeah.
like devoured it. And so like I have this vivid memory of me like being so famished. But also like it's an additional thing to think about.
Yeah.
Um,
It's
what
another
am I gonna
logistical thing.
and then you often end up just like snacking here, things here and
Yeah.
there because you're just too tired to go get groceries and think about what to cook and da, da,
Oh
da.
my God. Yeah.
So having like meals in the freezer, people bringing in, food when they come, I think is such a, great idea. And as you were saying, Anusha, also telling people when it's okay or not okay to come. Like I wanted
Yeah.
to come, but also not at this time or not this many
Yes.
people. And it's not because I don't want to, but just because it can get
Totally.
loud, it can get too exhausting. I don't want you to see me maybe in my, disposable
I
underwear.
don't know if I want you to touch my brand new baby. You're with your newborn, your first one. You're so scared. I'm like, don't breathe on this child. Like, all these people are. This was pre-COVID. Post-COVID,
Yeah.
I'm like, just don't come.
Mine was peak COVID. I was like, get out
Oh
of
my
here.
God, I all my respect. Gosh. But yeah, and also I would like to say, not to make this conversation scary, but things are changing in the way that women are talking more. Women are talking. Women are sharing their stories, their experiences. This conversation, I don't know if we could have had it
Yeah.
10, 15 years ago. I think I would have been like, your gender reveal and your registry are very important. Now it's like, hey,
No?
this is women are being real with each other, which is why I think these slow changes are starting to come, like paid parental leave, paid paternity leave. Now some men have leave and have more than we do.
That's
Yes.
But yeah, things are changing. But yeah, oh, sorry, my point was, be real, talk to your mom friends and ask them what they wish they would have known.
Mhm.
Yeah.
Oh my goodness.
And we're
It's a
too
whole
scared
different world.
sometimes to share. Like, I think about, no, my mother-in-law, she wanted to come, right? And I feel like in the beginning, I was like, how am I gonna tell her that maybe I want her to wait a couple of weeks and maybe then, she will get
Yeah.
offended. But then very often when you don't speak and you don't tell what you need, then it's gonna
You
get
don't get
frustrating
it.
and it's gonna create so much tension that it's not gonna be better. And so sometimes it's better to, be open about what you're expecting and how you can get help to make everybody feel like they're included and they can participate, but in the way
Right.
that it's really going to support you at best,
Yeah.
even if some of those conversations might feel a little hard at first. So
Mhm.
Yeah. And I think, it's important, because of course we want to be like, oh, I didn't want to hurt her feelings, or I don't want to insult my mother-in-law. But here is where I would really tell myself, my younger self, but also tell the birthing people and women on this webinar, give advocate for yourself. Give yourself the respect. You are so important. You're the star of this whole production. So you can say things like, my health is not good. I'm exhausted. I want a couple of weeks just alone with just family, and I'll send you a text or check in with me. And you know what? People will respect that.
Mhm,
Your boundaries are not other people's jobs. You have to put them in
mhm,
place. So,
mhm.
you don't have to be mean about it.
Yeah.
Yeah.
But
What
if
are
you need to be,
yeah.
Or
What
put
are
it on
some
your partner. Oh, can you tell these people I don't want them over here?
smart,
exactly.
smart.
I can't answer the text.
Let them do the dirty work. Let them do the dirty
Trying to
work.
catch the bus and your pelvic floor therapy, please
Yeah.
make sure you have your boundaries set.
Yeah.
And I was just thinking, um we are sort of opening up the conversation about the postpartum period in such a, candid and honest way, and I really love doing that. And I think, before we were saying uh a while ago we would have conversation about baby registry and gender reveal, and I feel like, what if we would close this last few minutes about the real thing that you should put on your baby registry? What are some things that you would recommend, like if a friend came to you asking how many onesie and how many PJs they need to put, and you were like, let's put that aside. You should add this two things to your baby registry. What are some things that you would add?
I want to quickly say that this new phrase that people are saying, I wish somebody had told me, which is postpartum is forever. This idea that it ends in 6 weeks or a year or this, no. If you can get a therapist or a group of new moms, this was something that really helped me when I was a new mom. There were other new moms in Capitol Hill at the time, and we had like a little mailing list. And I think there's a lot more mom groups like that. That was really helpful. Being able to hang out with 3 or 4 women whose babies were like just a week apart, and we would just get together, hold a glass of wine, and just it was like group therapy.
Mhm.
Nobody's really going to be checking in on you. And postpartum depression, postpartum, so many things are, it's a real issue. 20% of maternal suicides occur in the postpartum period. So, mom, you're going to have a major hormone crash. Some things are just science. So you have to be ready for that. And if you can be honest at that time, because you feel so bad, you feel like you're a bad mom, but you have to, once again, prioritize your health. You have to prioritize your health. You're so important. Your health is not an inconvenience, and that includes your mental health.
It's a great suggestion. Lexi?
Yeah, no, I love that with the mom friends, especially babies around the same age. Cause even some of that like stuff that seems so complicated or so confusing with some things, if you just have another mom friend with the same, and you only need one or two. You don't need,
One,
you only need
one
one.
health.
Just to bounce some of those ideas off. But for the baby registry thing, this is probably obvious. I'm gonna say this pelvic floor PT.
That
Because
is great.
like even if it was an uncomplicated delivery and pregnancy was easy, like even just one visit to go through, like, okay, your body has changed forever probably, and like these are the things that now it might feel like, and oh, this is happening because you're breastfeeding, or oh, you want to run a marathon again, okay, really, this is the way you should get up to it. And that early on saves you the headache and the other issues in 2 years when you just like started training for a marathon postpartum or something like that. So I think, that's a good gift to give a new mom.
Yeah.
That and like
Can I
a
ask, can I ask really quick, does insurance cover most pelvic therapy or no?
no, and unfortunately, so it
Of course.
depends, right? Of course. My practice, a lot of us are out of network with insurances because we need to spend more one-on-one time with our patients, and insurance obviously restricts the amount of time that we spend with a patient. So it again, it's a terrible thing here. You look at Europe and in France, you see a pelvic PT the second you give, right after you give birth, no
Wow.
matter what. And so that's a huge gap that we have here, that like pelvic PT is limited by insurance. So
A perfect item for a registry.
yeah,
What
And
exactly.
then,
a great
like
gift.
lactation support, I think would be something else that we
Mhm.
Lactation
think
support.
about a
Yes.
lot.
What?
Yes.
Oh my
So
goodness, we should totally do a Nanit gift registry, the alternative registry. like physical therapy, mental therapy.
Mental health, lactation. I would love to have add some like cleaning, help with cleaning the house cleaning,
Yeah,
meals, and so we
Meals.
already have we've got it covered. We've got it
yeah,
covered with all
I
these
love
needs. So
it.
so let's sort of I think we should have mom registry and not baby registry.
Mhm.
That's what we need. Um,
Yes.
so that's what the new term I will use from now on.
Yes,
Mom
Mom
registry.
registry.
I
yes, I
love
love
that.
that.
So, well, as we had foreseen, we already had gone through 1 hour. There's been so many, thoughtful comments and um, words of support in what you were saying throughout the conversation from all the people that have joined us today. And thank you again for finding time. We know that it's not easy to spend 1 hour. You're also busy, so your presence is really important for us. And I want to just remind you that we have 2 other events next week, the beginning of next week. So stay tuned. Look at our website if you're interested in joining more of our events. Thank you so much and have a great night. And thank you to you, Lexi and Anushai, for joining us. It was such an amazing conversation. And I'm so, I think it's just amazing to find people that you can be so honest and real with and learn so much from. So
Great
I
to
really
be
appreciate that.
connected. Thank you so much for being such a great host. Thanks for hosting us.
Thank you. Have a great
Yes,
night.
thank you so much.
Bye bye.